What is the difference between braces versus retainers?
So the main difference between braces and retainers are that braces move the teeth and they shift the teeth into alignment and ultimately result in a change from crooked tooth position to straight tooth position. Retainers are passive. They don't move the teeth and they maintain the alignment once we're done with active orthodontic treatment.
Why are braces and retainers both important?
Retainers and braces are both super important. Braces are used to straighten your teeth and achieve the smile you've been dreaming of. Retainers keep them that way. Without retainers, your teeth will rewind and go back to close to their start position of crowding and misalignment. And retainers can press pause and keep your smile just the way you want it.
Are there any situations where a patient can skip braces and use a retainer instead?
Sometimes patients can skip braces and go straight to a retainer. If you just want to prevent crowding that increases with age and you like your smile the way it is, all you have to do is come in for a scan and get retainers made to keep your smile the way you like it.
Does crowding always happen with age?
In 99% of the population, yes, our lower front teeth begin to overlap. And if you're curious if this is going to happen to you, look at your parents' lower front teeth. Genetics is often a very big component.
What age does that type of crowding start to show up?
So you've looked at your parents' teeth and you see that there is crowding. When should you take action? I often notice that adults in their 40s start to experience mild crowding. They've had orthodontic treatment in their teen years, and those results lasted pretty acceptably well through their 20s and 30s, and then in their 40s, they start to see a decline in the aesthetics, in the function, in the health of the bite, and that's where you really want to come in for an orthodontic consultation.
So how do you, as an orthodontist, decide when braces are needed?
How do I, as an orthodontist, decide on whether I'm recommending braces versus Invisalign to correct your teeth? Mild to moderate crowding can be resolved with either tool. If the crowding is so severe that teeth need to be removed to resolve that crowding, and this is very rare, sometimes braces are more recommended because of the consistent force that they apply on their teeth. If I have a patient come to me and say, I will be so consistent with Invisalign, we've even closed spaces from tooth removal using Invisalign. So it really depends on your personality and what you'll be able to handle with your lifestyle. Aesthetics are a consideration. How many hours a day you'll be able to wear the Invisalign is a consideration. And then there's also dietary changes. With braces, you have to avoid the crunchiest of foods, such as really hard granola bars, ice cubes, and hard candies. Whereas with Invisalign, you're able to take those aligners out and eat whatever you would like. So how I guide my patients is partially through their lifestyle, their preferences, and then also which tool would be better for their case. Occasionally, I even recommend a hybrid. We like to call it Invisibrace, where we have Invisalign on the top teeth, braces on the bottom teeth, and use each tool for what they do best.
Why not use Invisalign on the top instead of braces?
The reason we sometimes do a hybrid treatment is we get to use the best aesthetics of Invisalign on the top teeth that you show the most when you smile, and crowding is usually more severe on the lower teeth, so the hidden braces on the bottom can correct that at a slightly faster pace than Invisalign. This way, the braces are doing what they do best, and the Invisalign is doing what it does best.
If you had braces years ago but haven't worn your retainer for a long time and now notice some crowding, what should you do?
If you've had braces many years ago and you notice some crowding in adulthood, what should you do? Come in for a consultation. If the crowding is mild but your bite is still healthy, you'll have two options. One is to get a retainer to prevent further crowding and simply maintain your teeth as is. The second option is to pursue a touch-up and correction with Invisalign or braces to achieve a perfectly straight smile and a healthy bite, followed by retainers to keep them that way. Remember, retainers are nighttime for a lifetime.
Are there any drawbacks to wearing retainers?
Some of the biggest challenges with wearing retainers that I hear from patients is that they forget. They're tired at night, they've managed to brush their teeth, and they fall asleep without wearing their retainers. My best advice for this is to shift when you do your nighttime routine. Do it before you're exhausted. Have dinner, enjoy your dessert, and then go upstairs, Brush, floss, put your retainers in, and then enjoy your movie, read your book, or do whatever it is that you do at the end of the day. Other challenges to wearing retainers are having them lost or even stolen by a furry friend. So nothing smells more like you than your retainers. And dogs and cats love to reach for retainers and use them as a very expensive chew toy. So remember, I always say in your face or in your case. One of the benefits here at Bird Smiles Orthodontics is we understand that life happens. That's why we don't give you just one set of retainers to preserve that precious smile and all the progress you've made. Every patient who finishes treatment in our office finishes with 3 sets of complete upper and lower retainers. So if you lose one, or if a furry friend finds one, you always have backups. If you're considering orthodontic treatment and you're not in the Washington, D.C. area, make sure at your orthodontic consultation that you ask about the retainer protocol, what's included in your treatment plan, and those fees. If it's just one set of retainers, know that those only last 2 to 5 years and you will need retainers nighttime for a lifetime. Ask what the cost would be of an additional second or even third set of retainers, as those can range anywhere from $300 to $700 per set depending on the type of retainer chosen, and insurance may or may not cover it. Another challenge with retainer wear is keeping them clean and fresh. We always recommend storing your retainer in a bowl during the day so that they can dry out during the day, and only using a retainer case for travel when they're going on the road with you. To keep your retainers clean, we recommend brushing them with warm water and a toothbrush. Avoid toothpaste, as this can introduce micro scratches into the retainer and it just ends up trapping more plaque and bacteria. My favorite tool for cleaning retainers is our professional ultrasonic cleaner here at the office. At home, they are selling personal retainer cleaners, little dental pods where you put in a tab of Effordent or similar cleaning solution and freshen up your retainers on a weekly basis at home.
What are the biggest challenges when wearing braces?
Some of the biggest challenges with wearing braces is changing your diet so that you're avoiding crunchy foods that would lead to breakage of the braces. If a brace is mobile on the wire and moving, it's not loose, it's broken, and it's not going to straighten the tooth that it's no longer attached to. So avoiding crunchy foods is the best way to avoid breakage. When patients come to me with frequent breakage, we normally see it in the lower molar area, and that's from crunchy foods that are being eaten that are breaking the braces off the teeth. Foods like stale bread, hard pizza crust, very crunchy granola bars, or hard candies are strong enough to break the brace off of the tooth, and that ultimately slows down treatment. If you think you've broken a brace, take a look in the mirror. If the brace is missing off the tooth and there's just a length of wire, that means the brace has fallen off, broken off the tooth, and it's time to give us a call. We want to see you within 1 to 2 weeks to put the brace back on to avoid slowing down your treatment. Another challenge patients have to deal with when getting braces placed is the initial first 4 days of when the braces go on. This is when the inside of your mouth has to get used to the roughness of the braces, and we recommend wax whenever there's an area that the brace is rubbing or irritating the inside of your mouth. After the first week or so, the inside of your mouth adjusts to the braces and the texture of them, and you no longer need the wax. An example of foods that are okay to eat in braces but oftentimes get stuck in them and you may want to enjoy privately are steamed spinach. This is okay to eat. It won't break your braces, but oftentimes gets stuck, and it takes extra effort to clean out of your teeth and your braces. The second example is an everything bagel. The poppy seeds and all of that yummy flavor on the bagel can get stuck between your teeth even if you don't have braces. And if you do, it's just extra effort to get them clean again. So okay to eat, but best done in private. If you're out at a restaurant and you think something is stuck in your braces, my best advice is to first take a big gulp of water, swish it around, and see if that will dislodge the food. Next step is to maybe excuse yourself, go to the restroom, and keep handy a small proxy brush. It's about this big. My favorite tool for dislodging food while on the go is a proxy brush. It's small enough to fit in your pocket or purse, has a cover, and is very travel friendly. If something's stuck between your brace, simply slide the brush under the wire, above the brace, or in between, wherever the food is stuck, and this can help get it out.
What are some tips for starting orthodontic treatment?
Here are my top 3 tips for starting orthodontic treatment. 1, be patient. The process takes time so that it's gentle on your teeth and you don't experience discomfort. 2, it's time to get going. The sooner you start, the sooner they're off. Now is the time to prioritize you and your smile. Number 3, there's a learning curve. It takes time to learn how to take your Invisalign in and out discreetly. I promise, week 1, it's a project, and after that, you figure out how to do it subtly. Similarly for braces, it takes time to get used to having your teeth in motion, to get used to the feeling of the braces, and before you know it, you'll start to see your progress.